Compassion is crucial for veteran healthcare. My name is Scott Murphy. I am the co-founder of a veteran nonprofit called Veterans for Safe Access and Compassionate Care. The reason that me and my friend started Veterans for Safe Access and Compassionate Care is that we noticed that there was a crucial hole in the veterans healthcare system that we have right now. The healthcare system right now is geared more towards Vietnam veterans, and there's a slight disconnect between Iraq and Afghanistan veterans and Vietnam veterans. So the care needs to be different. You have several nonprofit groups, Veterans for Foreign Wars, American Legions. You have all these other groups, but a lot of younger combat veterans, when they go to talk to them, are kind of realizing that they're hitting a wall and that there's just a real disconnect. The other thing Veterans for Safe Access and Compassionate Care is passionate about is getting red tape out of the healthcare system for veterans. We use the government healthcare system. As you may know, medical cannabis is a new push for a lot of ailments. One of them is a condition that some veterans suffer with, which is post-traumatic stress syndrome, or also TBI, traumatic brain injury. Some of the symptoms of TBI can be kind of some of the things that we're learning about, which is, passive aggressive behavior, and this is due to injuries of the brain. Recent research has been shown that medical cannabis may not only help the brain, but it actually might help to bring new cells back to life, which is very critical for someone that has suffered from TBI. The other thing that we hope to do with Veterans for Safe Access and Compassionate Care is to be an intermediate between combat veterans and the public. As a combat veteran myself, I realize that there's certain differences when you're talking to a civilian as compared to when you're talking to someone else that's a combat veteran. So if a combat veteran has to talk to a healthcare provider or a psychiatrist, and that psychiatrist hasn't been in combat, then they might feel like that they're just not getting them, no matter how much they shake their head and nod that they're understanding. So this is why compassion should always be at the forefront, and this is why I really feel like it's best that veterans take the lead in help facilitate the care for other veterans. The other thing that Veterans for Safe Access and Compassionate Care strives to do is to always stay on top of new research that comes out for the best care and compassion that a veteran can get. So we hope to speak in front of the state houses anytime there's legislation for medical cannabis. I've already spoke once in front of the Capitol in DC for a bill that came out that would establish medical cannabis being a state issue as opposed to a federal issue. I hope to be able to take a trip to Israel. The Ministry of Defense in Israel is actually one of the largest producers of medical cannabis and is for their combat veterans suffering with PTSD. Everyone's familiar with medical cannabis has a component called THC, which makes you high or the euphoric phase. There's actually some substances that people know less about, and these are called CBDs. CBDs are good because they actually lower the effect of the high, but they really hit more the crucial kind of components of the cannabis plant, which is directly benefits for people with PTSD and TBI and other conditions. So this is why compassion is so crucial in veterans.